Okay. CPR and AED, guys. Should be a little bit of a refresher for you from Health 1001. Remember with CPR, we're going to do 30 to 2, so 30 compressions to 2 rescue breaths. We'll do 5 cycles of that, or 2 minutes, or pump and chest between 100 and 120 compressions a minute, 2 inches deep, full chest recoil in between compressions. Easiest way to make sure that you stay on that beat is going to be using a metronome. You can use your phone. The new LifePak 15s have metronomes on them. I think that the new Zoll Series X has a metronome on it. So we're going to go ahead and get started. First things first, we're always going to have our PPE. We'll get dispatched to a man down, so we're going to ensure that our scene is safe before we get there, when we get on scene, and while the whole scenario is progressing. Scene safety is a very dynamic and living creature, so it's going to change from 1 minute to the next. As we're approaching the patient, we're going to get our general impression. We're also going to ask our bystanders, hey, what happened? Try and figure out anything that led to the patient collapsing. If he just went down, if he tripped, if he fell, if anybody knows anything about him. As we come up, hey, sir, can you hear me? Okay, we're going to start assessing his level of consciousness. Sir, are you okay? Whenever we don't get any response, we're going to look, listen, and feel. So I'm going to check a carotid pulse. Always want to do it on my side closest to me. I don't want to reach across. That looks extremely bad, but for the sake of this video, I'm going to go ahead and reach across to show you what I'm doing. So we're going to check for a carotid pulse. I'm going to put my face down and listen. We're going to count for 5 seconds, no longer than 10 seconds. So 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi, 6 Mississippi, 7 Mississippi. Okay, we have no pulse, no respiration, so I'm going to have a bystander call 911, call ALS, get an AED, and come back. I'm going to do that by identifying somebody specifically. So, hey, I want you to go call 911 or ALS, bring an AED, get an AED, and come right back. We want to make sure and tell them to come right back, because in moments of panic, if you tell somebody to get an AED, they're going to grab it and they're just going to stand there with it. They might not necessarily come back. As soon as we do that, we're going to start our compressions. So I'm going to go ahead and get my hand positioning in the middle of the sternum, interlock my fingers, and we're going to begin. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Grab our BPM around. Then back into it. 1, 2, 3, 4, 6, 7. After our 5th cycle of compressions, AED will arrive. My partner is going to take over. I want you to do 30 compressions to 2 rescue breaths, 2 inches deep, allowing for full chest recoil. I'm going to immediately start setting up my AED. I'm going to turn it on, pushing the on-off button. Open up my pads.
Bare chest. Plug in pads connector next to flashing light.
We're going to follow the directions on the pad. So this pad here goes on the right side of the chest.
Apply pads.
Other pad is going to go upper left. As soon as we're done with that, our connector is going to go in where the flashing yellow light is. Keep doing CPR. Partner is maintaining CPR this entire time.
Analyzing heart rhythm.
Okay. Don't touch the patient.
Do not touch the patient. Shock advised. Charging.
Continue CPR.
Stay clear of patient.
Keep doing
Deliver
CPR.
shock now. Press
I'm clear, you're clear, we're all clear. 1, 2, 3, shocking.
Shock delivered.
Continue CPR.
Paused.
At this point, we would
Begin
continue
CPR.
doing 30 to 2 for our compressions to ventilations ratio. Make sure that your pads are in the correct place. Yeah, that's it.